In air pollution, it's a more complicated situation because, as you know, we don't have exposed and non-exposed, but everybody is exposed to some degree. So we have this continuum of people being low exposed, a little bit higher, more exposed, very high exposed. So this is a continuous scale. So let's not go into the mathematics. Of course, the same concept of combining relative risks and the number of people who are exposed, you can calculate on a continuum. Yeah? So you can integrate all these functions on the full distribution of exposure. And that's what you can do. So the epidemiological studies who have looked into, let's say, the health effect of air pollution on mortality, if the contrast in exposure is standardized to, let's say, 10 micrograms per cubic meter of particles, for example, we know from several studies, if you wait something like 10 years or so, the relative risk of dying earlier is in the range of a couple of percent, 7%, 8%, 10%. It depends a bit on the study designs, but it's in that range. So this is far lower than what we see, for example, for smoking and lung cancer, where the relative risks can be 8 or 10. So we talk about a maybe 10% increase per 10 micrograms per cubic meter, and that is relatively low. But, as explained before, if it's about calculating the population-oriented risks, the population-attributed refraction, this becomes pretty important because in air pollution, of course, everybody's exposed. So the percentage of people who are exposed is usually 100%. And that's why we end up with very big numbers if we calculate the overall impact. That's why WHO has published these numbers of like 7 million are attributable to indoor and household related air pollution, for example. So that is behind these numbers.